Yeah, so thank you, Robin, for the very kind introduction. I'm now going to present a study which I started during my master studies here in Oldenburg. And yeah, it took some time to finish it because after my master's, I went to another lab. And when I came back 2 or 3 years ago, we decided to finish this study. And yeah, so finally we were able to publish it this year in Music and Science. And yeah, so during the study, I really learned a lot. And my experience was from the study that that things do not always work as expected. Yeah, so a very, very short introduction in chronic lung diseases. So these diseases are really relevant because they belong to the 10 leading causes of death worldwide. And around 10% of the population over 40 years are affected by a chronic lung disease. And there are several different diseases, but there are two diseases which are most frequent, and these are the chronic obstructive pulmonary disease and the chronic asthma. And of course, there are a lot of differences between these diseases, but there are also some similarities. And yes, and there are some similarities in the symptoms of these diseases, especially in the breathing-related symptoms. So people affected by chronic lung disease, they often show symptoms of dyspnea, so they are short of breath, and they show abnormal breathing patterns, so they have a very rapid and shallow breathing. And because of that, they also have a reduced oxygen saturation, which is, of course, in general, not good for the general health status. And next to these more breathing-related symptoms, they often also show depressive symptoms, probably because they experience a lot of restrictions in life due to the breathing-related problems. Yeah, unfortunately, both chronic lung diseases are not curable. But of course, we can treat the symptoms of the diseases. And first, there are a lot of pharmacological treatments, but I will not talk about these treatments today. So I think we'll leave that to the medical doctors. But next to the pharmacological treatment, there are also already some recommended non-pharmacological treatments, like physical activities or breathing exercises, like yogic breathing, and also strategies to reduce stress. And as musicologists, so we wondered, okay, and how far can maybe music also be beneficial for people suffering from a chronic lung disease? When we look into the literature, then we already find some studies, and a lot of them are about choral singing, and they show that choral singing leads to a reduction in physical symptoms, especially in experienced dyspnea, and that choral singing also leads to a reduction in psychological symptoms. So people show improved mood after singing. Relating to listening to music, it has been shown that listening to music can be a good distraction to increase the physical exercise, and that it also can lead to a reduction of dyspnea and depressive symptoms in people suffering from a CLD. And yeah, it has been shown that especially music with a slow tempo, around 60 or between 60 to 80 beats per minute, is especially suitable for that for these people. But what we not know from those studies is what mechanisms lead to the reduction in dyspnea. So is it because the participants experience reduced stress because the music has a relaxing effect? Or is it maybe that the music influenced their breathing patterns? So maybe the music can reduce the breathing rate. And also from that studies, we don't know if there's an immediate effect of listening to music because all those studies were intervention studies. When we look into the literature about short-term effects of listening to music, there are already some results from healthy samples. And it has been shown, for example, that listening to relaxing music can reduce the breathing rate. And other studies showed that in general, the breathing rate adapts to the tempo of the music. Moreover, studies were able to show that music can reduce stress, and this was also found for older adults. But still, we don't know what is the effect on people suffering from chronic lung diseases. So from there, we came to our research questions. And the first was, does listening to relaxing music, so slow music, reduce the breathing rate in people suffering from chronic lung diseases? And moreover, does listening to relaxing music positively influence affect in people suffering from chronic lung diseases? Yes, and then we were wondering whether people with a chronic lung disease are able to spontaneously adapt their breathing to the music, or whether they need a special instruction to control their breathing. So we tested also this question. Yeah, and to answer these questions, we designed 2 listening experiments. They were exactly the same, but only differed in the instruction of participants. So in experiment 1, we were interested in the spontaneous reaction to listening to slow music. And the participants were instructed to relax and focus on the music. So we call this the music-related instruction. And in this experiment, we had 28 participants with 22 females, and 14 of them had a chronic lung disease. And then we also had 14 control participants without a chronic lung disease. In the second experiment, we were interested in how far a breathing-related instruction can support the breathing pattern. And here we instructed the participants to breathe slowly with a breathing cycle around 4 to 6 breaths per minute. So this is from a yoga breathing technique. And here we had 30 participants with 21 females and 12 of them affected by chronic lung disease, and the others were controls. Yeah, so we took some physiological measures. So especially we were interested in the breathing rate and in the oxygen saturation of the participants. And for the measures, we used the Nexus 10, which is actually a biofeedback device, but is also commonly used for research. As a psychological measure, we measured affect. So and for this, we used the positive and negative affect scale, the PANAS. And of course, we also had some control variables like the health-related quality of life, and another measure which measures the disease-specific quality of life. We asked the participants whether they liked the music or not, and how far they were familiar with the music or not. And we asked them to rate how they perceive the music. So on a 5-point Likert scale, we asked them in how far they perceive the music as activating, calming, happy, or sad. Yeah, these are some sample characteristics from both experiments. So we can see that in both experiments, the sample was quite old, around 68 years old, which is not surprisingly because chronic lung diseases, so especially the COPD, occurs later in life, from 40 to 50 years. Yes, and I just highlight one interesting finding. So in experiment 1, we saw that the people affected by a CLD showed a lower quality of life related to the physical health. So here, lower score indicate lower health. And we didn't see this in the second experiment. So both groups were quite equal. Yes, and this is also reflected in the disease-specific quality of life measure. So here it's the other way around. Here is it that higher scores indicate lower health. And here we see that in experiment 1, the participants with a chronic lung disease seem to be more severely affected than in the other experiment. So we can just keep this in mind when I talk about the results. Yes, so the music stimuli. we decided to use experimental selected music just to better control the music stimuli. And we did a short pre-test with students to find a good piece of music which is relaxing, and in contrasting to that, another piece of music which is perceived more activating. And we had a choice of 6 classical pieces of instrumental music, so 3 relaxing and 3 activating. And we asked the students to rate on a 5-point Likert scale and how far they experienced the music as relaxing or activating. And we also recorded the breathing rate to see which piece of music induced the lowest breathing rate. So the result was, for the relaxing music, that we chose the Adagio from the clarinet concert in A major by Wolfgang Amadeus Mozart. And as the contrasting activating music, we used the Hungarian march from the Damnation of Faust by Hector Berlioz. Yeah, so this is the procedure of the main experiment. I hope you can see it. So the participants came to our speech and music lab here in Oldenburg. And of course, first they gave their informed consent to participate in the study and filled out some demographic questionnaires and also the questionnaires about the quality of life. And after that, we asked them to fill out the PANAS scale as our baseline measure for the PANAS. And then we prepared the sensors of the biofeedback device. And after the preparation, there were 5 to 10 minutes for the participants just to become familiar with the situation and for the signals to settle down a bit. And then we started with a baseline measure, which took 5 minutes. And after 5 minutes baseline measure, we presented the first music piece, which was either the activating music or the relaxing music. So the order was randomized. So on both music pieces were around 5 minutes. And after that, there were 5 minutes of silence as a washout period. And during these minutes, we asked to fill out the PANAS again and also ask about the perception of the music piece they just heard. Yes, and then we presented the other piece of music, and after that, they filled out the PANAS again. So we have 3 conditions in our experiments. We have the baseline condition, we have the activating music and the relaxing music. And yeah, so in dark blue, you can see the conditions. And during that sections, we did the recordings of the physiological measures. And for our analysis, we only included the middle 3 minutes of these measures and cut the very first and the last minute to avoid the influence of orienting and fatiguing responses. Yeah, so and these are the instructions. So as I already told you, the procedure was the same for both experiments. And in experiment 1, the participants received the instruction, please try to relax yourself and listen to the music. Focus your attention to the sound of the music and turn your attention to the music consistently. And in experiment 2, they received the instruction, please try to breathe with the music. Breathe about 4 to 6 times per minute. Pay attention on a preferably long exhalation phase, and your exhalation should be approximately twice as long as your inhalation. Yeah, so now I come to the results, and I will start with the first experiment with the music-oriented instruction. Yeah, so when we analyzed data, we found a main effect for the condition, and we saw that the breathing rate is overall participants higher during the activating music compared to the baseline measure, which is maybe not surprisingly. We didn't find any effect for the relaxing music. Yeah, so relating to the oxygen saturation, we didn't find any significant effect of the music. Descriptively, we see that the participants with chronic lung disease seem to show a lower oxygen saturation, but in our model, this was not significant. But also this would not be surprising me, actually. Yeah, regarding positive affect, we found a significant group by time interaction. However, the post-hoc analyses were not significant because due to the multiple comparisons, we set the p-level to 0.16. So it seems descriptively that for the group with the CLDs that the affect, positive affect is lower after listening to the relaxing music. So that was actually not our intention, of course. Yeah, and then we were interested, okay, why did the positive affect decline after listening to the relaxing music? And we looked into the ratings about the music pieces. And we found that the participants with a chronic lung disease rated the relaxing music as more sad compared to the participants without a chronic lung disease. So this was an interesting side effect or side finding. Yeah. These are the results from the second experiment, so the participants with the breathing instruction. Yeah, also here we found a significant main effect for the condition. It was quite similar to the first experiment, and we also found that the breathing rate during the activating music is higher here compared to the relaxing music, and it just failed significant in comparison to the baseline measure. But also here we didn't find an effect of the relaxing music, although the participants were instructed to breathe slowly. Yes, and relating to the oxygen saturation, first we also found a main effect for the condition, but then the post-hoc analyses were not significant. We just saw a trend that that it seems that the oxygen saturation becomes lower during listening to the activating music, which maybe makes sense when the respiration rate is higher and the breathing pattern becomes more unbeneficial, that then maybe the oxygen saturation becomes lower. Yes, and interestingly, the results we found for the positive affect, that it decreases after listening to the relaxing music. In the CLD group, we didn't find that in the second experiment. And when we look into the ratings about the music piece, we see that both groups rated the music pieces similar. So both rated the relaxing music as more sad, but there was no difference between the CLD and the non-CLD group. So this was quite interesting, and probably it is due to the fact that the people in the first experiment with a chronic lung disease were more severely affected by the disease. Yeah, so in sum, our study shows that there's no effect of listening to relaxing music on the breathing rate and oxygen saturation, irrespective of a chronic lung disease and irrespective of a breathing-related instruction. We found that the activating music leads to a higher breathing rate, which is not beneficial for people suffering from a chronic lung disease, because they already show a rapid breathing pattern. The relaxing piece of music was perceived as more sad in the first experiment, and so we thought that it could be that the health status maybe influences the perception of the music, which is maybe quite interesting. Yeah. But in some, we didn't find, so we can say that there's no immediate benefit of listening to relaxing music. So the question is whether a long-term intervention can maybe be more beneficial, because we know that people with a chronic lung disease need some exercise to control their breathing, so they're not really able to do that spontaneously. Yeah, so of course there's some limitations in our study. We are very dependent on our stimuli we chose. So we only had one piece of music for the relaxing and for the activating music. So from here we can't generalize in general to relaxing or activating music. So for further research, it could be beneficial to have a broader selection of the music, and maybe an idea could be to use strongly pulsed music. Maybe it's more easy to breathe with a more pulsed music. And of course, our sample sizes in the experiments are quite small. Yeah, but it was not possible to increase the sample size because we didn't find more people affected by chronic lung disease, which is actually good, I think. Yeah, so from our study, we can conclude that music or listening to music is not unequivocally positive in vulnerable groups, such as people suffering from a chronic lung disease. And yeah, it might be interesting to look into longer-term interventions for further investigations. And yeah, so thank you for attention.